ಕೃಷ್ಣ ಸರ್ ಶುರು ಮಾಡೋಣ ಸರ್.
Yeah, please start.
ಅಶೋಕ್ ಸರ್ ಕ್ಯಾನ್ ವಿ ಸ್ಟಾರ್ಟ್?
Yeah.
ಗೀತಾ ಮೇಡಮ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಿ. ಗೀತಾ ಮೇಡಮ್.
Good afternoon, one and all. I hope everyone is safe during this pandemic. Welcome to the international webinar of Seshadripuram Evening Degree College on menstrual health management. At the outset, I am happy to inform you all that our evening college celebrating its golden jubilee year. On behalf of college, we congratulate all the stakeholders. Chetana Women Empowerment Cell, in association with Water Supply and Sanitation Collaborative Council, Geneva, Switzerland, Tata Trust Mumbai, India, and Jatan Sansthan Udaipur, Rajasthan, India, is organizing international webinar on Sakhi Manthana, menstrual health management. India has around 355 million menstruating women and girls who face multi-layered barriers to effective menstrual hygiene management due to various social and economic factors. According to the latest data collected by the Ministry of Health, only 12% of women and girls have access to sanitary napkins in India, while a majority of them relies on outdated, unhygienic method during menstruation. In this backdrop, we conducting today's webinar. I now request Sunil sir to play the video of our college.
With a small step, proving this true. All began in 1930 when two women educational enthusiasts took up a noble initiative. In the erstwhile posh locality of Seshadripuram, Srimati Anandamma and Srimati Seethamma started a primary school with 20 children. Now, Seshadripuram Educational Trust under its umbrella has 36 institutions. It all began with the educational visionary Sri K.M. Nanjappa, the then President of Seshadripuram Educational Trust. In 1971, which has been a landmark in the history of education for the working students by starting Seshadripuram Evening College.
Our college started with the primary objective of imparting formal education to the quality and needy. The college is affiliated to the Bengaluru Central University. Being in the heart of the city, it has an easy reach and connectivity. Its premises comprise of spacious building with good canteen, computerized library, business lab, browsing center, Wi-Fi sports club, thus well equipped for all academic, sports, co-curricular like NSS, NCC, YRC, etc. and extracurricular activities throughout the year. The college organizes orientation program for freshers and guest lecturers to equip them.
As most of us are working in the morning and studying in an evening degree college, it is very facilitative for us to excel in our jobs. Even though we are studying in an evening degree college, we are being provided many state level and national level opportunities to express our talents. Also, many cultural activities are being conducted.
SEDC is engaged in various cultural activities throughout the year. There are numerous committees in the college that perform variedly on their behalf and have a lasting effect on the college, students as well as outsiders.
Our evening degree college believes in the vision to ignite the minds of every student to identify and develop their inner strength, with the mission to promote holistic development of students by offering quality education and making them self-reliant and progressive.
Our college NCC cadets will visit every academic year in Officers Training Academy Chennai and INS Kadamba Naval Base at Karwar. It will motivate our college NCC cadets to join Indian Armed Force.
Thank you, Sunil sir. I now request our beloved principal, Professor N.S. Satish sir, to welcome and introduce all the dignitaries to this international webinar.
ಥ್ಯಾಂಕ್ ಯು ಗೀತಾ ಮೇಡಮ್. ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಹ್ಯಾಪಿ ನೂನ್ ಟು ಇಂಡಿಯಾ, ಹ್ಯಾಪಿ ಮಾರ್ನಿಂಗ್ ಟು ಸ್ವಿಟ್ಜರ್ಲ್ಯಾಂಡ್. I take this opportunity to welcome you all for this international webinar in association with Water Supply and Sanitization Collaborative Council, Geneva, Switzerland, Jatan Sansthan, Udaipur, Rajasthan, and Tata Trust, Mumbai, India. At the outset, I would like to introduce and welcome Dr. Udepi Krishna, President, Karnataka Gandhi Smaraka Nidhi, and Honorary General Secretary, Seshadripuram Education Trust, who is inaugurating today's webinar. Sir is a transformation leader with a rare blend of technologist, educationist, social activist, and humanist. Sir is a recipient of Eminent Engineer Award and prestigious fellowship of Institution of Engineering and Technology UK and World Academy of Productivity Science Canada. In recognition of his dedicated service to the nation, Dr. Krishna has been conferred with President's Gold Medal, the highest national award given for Red Cross humanitarian work of high order by the President of India. Sir, on behalf of Seshadripuram Evening Degree College, I welcome you for this webinar. Further, I would like to introduce and welcome today's keynote speaker, Dr. Virginia Kamova, technical expert, menstrual health and hygiene, WSSCC, Geneva, Switzerland, hosted by United Nations Office for Project Service in Geneva, Switzerland. She is also the coordinator of Global Menstrual Collective that advocates for increased and improved investment in menstrual health and hygiene. She had worked as Senior Global Advocacy Officer for WSSCC, Global Advocacy Coordinator for Site Savers, Health Program Manager for Care International in Malawi, Managing Innovative Rights-Based Programs, and Gender Issues Officer, the Coordination Unit for Rehabilitation of the Environment in Malawi. Madam, on behalf of Seshadripuram Education Trust, I welcome you for this international webinar. Namaste. Akbar, welcome you, Misro. I hope I pronounced properly. I would like to welcome today's key speaker, Dr. Lakshmi Murthy, Additional Director, Jatan Sansthan, Udaipur. Madam has been working in the field of menstrual health management for more than 2 decades. Her work is deeply rooted in the belief that all girls and women have a right to be healthy and clean at the times and especially during menstruation. Madam is a recipient of Communication for Social Change, Meritorious Commendation Award by the Centre of Communication and Social Change from the University of Queensland, Australia. Honorary Fellowship from the International Rural Network, Canada. MacArthur Fund for Leadership Development Fellowship and Bernard Canyus Fellowship from Orkelton Trust, UK. On behalf of Seshadripuram Education Trust, a warm welcome to you, Madam. ನಮಸ್ಕಾರ ಮೇಡಮ್. ಇಂದಿನ ಅಂತಾರಾಷ್ಟ್ರೀಯ ವೆಬಿನಾರ್ಗೆ ಹೃತ್ಪೂರ್ವಕವಾಗಿ ತಮ್ಮನ್ನು ಸ್ವಾಗತಿಸುತ್ತೇನೆ ಮೇಡಮ್. Now, I would like to welcome today's guest of honor, Mr. Vinod Mishra, India Coordinator, WSSCC, who is the key person in materializing this webinar. Sir carries on experience of more than 25 years with 18 years of exclusive experience in water and sanitation sector. He has developed strategy of WSSCC to support Swachh Bharat mission in India for next 3 years. Sir, on behalf of Seshadripuram Education Trust, I welcome you for this international webinar. I welcome another guest of honor, Lara Gulia, Senior Executive, Tata Trust, having specialized in social work, counseling, and psychology. She has been working in development field with Tata Trust for the last 5 years, initiated in menstrual hygiene management program focusing on normalizing menstruation in rural interiors for the Tata Trust in 2016, which has now covered over 1 lakh beneficiaries. A warm welcome to you, madam. I am immensely proud to introduce and welcome Sri W.D. Ashok Sir, Honorary Trustee, Seshadripuram Education Trust. Sir holds Masters in Pharmacy, specializes in the field of total parental nutrition. He served at famous Al Adin Hospital, Kuwait, over 13 years. Sir is the real strength of our evening degree college. I welcome you, sir, and I request you to preside over this international webinar.
Thank you. Thank you.
Thank you, sir. I welcome all the office bearers and trustees of Seshadripuram Education Trust and all the principals of our sister institutions, other heads of the institution, conveners, volunteers, and all the participants who have registered across the globe. I welcome Darapa Konnur, convener Nisarga Mitra, Srimati Geeta, convener Chetana, the Women Empowerment Cell of our college, and Sunil Kumar, IQSC coordinator. And finally, I welcome our own teaching and administrative faculties to this webinar. Thank you, one and all.
Thank you, sir, for welcoming all. On behalf of all, I welcome our beloved principal, sir, to this international webinar. Welcome, sir.
Thank you, madam.
The man who has brought the global recognition to Seshadripuram Educational Trust, who is none other than Dr. Udupi Krishna, sir. I now request our Honorary General Secretary, Dr. Udupi Krishna, sir, to render inaugural address.
Good afternoon, all of you. Mrs. Virginia Kamova, Technical Expert, Menstrual Health and Hygiene, Water Supply and Sanitation Collaborative Council, Geneva. Dr. Lakshmi Murthy, Additional Director, Jatan Sansthan, Udaipur. Shri Vinod Mishraji, India Coordinator, WSSCC. Ms. Lara Gulia, Senior Executive, Tata Trust. Principal of the college, Professor N.S. Satish. My esteemed colleague on the Board of Trustees, Mr. W.D. Ashok. Professor Sunil Kumar, Professor Dharepa Konnur, Professor Varshini Sushma, and all other distinguished faculty, and over 1,600 registered participants from across 16 countries. Friends, let me at the outset congratulate Seshadripuram Evening Degree College, which is now in its 50th year of its existence, serving the cause of education of the poor and the underprivileged, for having organized this program through its Women Empowerment Cell. And as already said by our principal, this is an international webinar focusing on menstrual health management. This is a very important subject. I have also been not only an educationist, but also one connected with voluntary social service. And for a long years, I was connected with the Red Cross movement. Therefore, friends, I personally feel that this is a very great subject that needs focus at all levels in all countries, not only these developing countries, but everywhere. And this is something that is very, very important for mankind itself. Friends, menstruation is a natural biological phenomenon. This should be understood as something very natural, and it is very, very natural, particularly for our girls. Therefore, it is not that menstrual education is required only for girls. It is required both for boys and girls, men and women alike. To us, particularly who are in India, you know, India is largely a rural-based country, Even today, over 65% of our population still lives in the villages. And our socio-cultural environment is uh, quite peculiar. And because of this socio-cultural environment that we have, unique environment we have here, our girls and women are surrounded by various kinds of taboos and myths relating to menstruation. Till recently, let me tell you, people would not discuss this in public. It was considered such taboo to that extent. Even educated people would not dare discuss this in public. And today I am happy that with education being spread all over, today this has become a matter of public discussion. This is definitely a very positive development, and I must congratulate the college for having taken up such a wonderful subject for discussion. I'm happy that experts from all over from different countries have come together to share their views in the short span of 1.5 hours of this webinar program. And they are going to share their thoughts and views on this vital subject. Friends, these taboos and myths have really affected the emotional health of our women, particularly in the rural areas. And even today, the knowledge about puberty, menstruation, and reproductive health have been very, very minimal in our rural population, even in our urban population, particularly the uneducated urban population. So what, as we have also seen during our own childhood, this particular menstrual issue was considered as something, a very secret thing, and that is not supposed to be discussed with others. And this secrecy has created a lot of problems for women. And the socio-cultural context in which India is situated, we have so many problems. And even today, our so many rural pockets in this country still consider menstruation as something dirty and impure. Our women are isolated. They are not allowed to come back to their routine once their menstrual period starts until it is over. And then they are not allowed inside our kitchens. They are not allowed inside sometimes, into our puja rooms. So there is our prayer rooms also. So this is the way that our people are being treated. And menstruating women are also labeled, as unhygienic and unclean. This is something that has put our society in a very bad situation. And all these taboos ultimately have resulted in fear, shame, and embarrassment surrounding our sexual reproduction in our society. In rural areas also, the taboo is so much that even girls who are studying in schools, and once they enter puberty, many of them withdraw from their schools only because of this menstrual problem. I feel that most of the schools in rural areas do not have adequate toilets. And this has also been causing a lot of problems. And usually, even mothers are not properly educated about menstrual hygiene. This is another area that is bothering us. And usually, most of the mothers, they also shy away from discussing these issues with their own daughters. And with the result, children also suffer a lot in their day-to-day life. Friends, today girls' education is receiving all priority, but the basic infrastructural facilities need to be spruced up in a very big way in our schools, particularly in our rural areas. And our teachers should spread this menstrual education, menstrual hygiene as a part of their curriculum. This is what I also feel. And teachers, particularly women teachers, should take these girl students, into confidence and then try to give them their counseling. And not only this, even men also need to be made aware of these menstrual hygiene, because they can indirectly support not only their daughters, their mothers, even wives, students, employees, and everyone. And therefore, this knowledge of menstrual health management is not just, as I already told you, not just it is referred only to girls, but also to everyone in the society. I think only if there is proper understanding in the society, with every section of the society, I think we will be able to tackle this problem or manage this problem in a very efficient way. And one thing I would like to tell you, that menstruation is something very natural. It is a very unique phenomenon. And then the power of procreation is there only because of this God gifted, what I call this biological phenomenon. And therefore, it is a virtue, and we need not treat it as what I call a taboo. Friends, we have to educate girls not only in the schools but also at the family level, and we need to educate these girls even in the colleges also. And I find, and recently in the last 2-3 years, we in our group of educational institutions, we have introduced this supply of free sanitary napkins for our children. Till almost 70 years of our freedom, we did not pay attention to this serious problem affecting our women. And so what I feel is that if we pay little attention about educating children about, bringing about awareness on this menstrual health system, hygiene, I think we will be able to develop their self-esteem and then self-confidence in the girl children. Friends, I also feel that if you are educating a man, you're educating only one individual. But if you're educating a woman, you are educating the whole family. So that is also most important. I remember in 2009, when I was the head of the State Red Cross in Karnataka in India, we arranged what is called the health checkup camps in rural areas. To my surprise, we had taken a team of women doctors there. And to my surprise, people were not bothered, particularly women. They came in large numbers because there were not a sizable number of women doctors. And then they were all not talking about any general health problems, but only particularly the health-related issues of women, and that too related to hygiene, and that to menstrual hygiene. And then so we had to arrange separate camps for them, separate educative programs, so that they come out of this. And lot of myths, lot of doubts, confusion about this hygiene has caused a lot of innumerable problems for women. And also not only that, see, if we need to have healthy mothers for the future, we need to take care of this vital aspect. And also most of the rural women in those days, we found that, they did not have the adequate hemoglobin levels. Then we took up what is called the 12/12 program. At least by the age 12, they should have hemoglobin level of at least 12. And that was the idea. And then we started giving them iron tablets, etc., and try to help them. The idea is that we should, if we want to have healthy mothers, we want to have a healthy future for our children, then we need to take care of these healthy mothers who are prospective healthy mothers. And friends, I'm very happy this program, I'm sure, because with the number of experts coming on board, we'll be able to clear all the myths and taboos that are surrounding menstruation. Because I think the awareness is the key. This is not a very difficult thing, but unless we bring about awareness, we cannot do anything. One thing I want to very emphatically give as a message at this inauguration, that women are not impure. Correct information about hygiene will definitely clear all misconceptions about menstrual blood flow and things like that. And one need not feel that it is something very unbearable or intolerable or anything. And therefore, we need to understand, cooperate, and see that we follow healthy lifestyles. And as I already told you, world over, this menstrual hygiene management should become a part of the curriculum, and there should be an open discussion in the schools and colleges, and also in public platforms, so that the entire section, all sections of the population is educated and a proper awareness is brought about menstrual hygiene management. With these few words, I happily inaugurate this most important webinar, and I request all of you to proceed with the work of this webinar. Thank you very much.
Thank you, sir, for the inaugural address. May I now request Dr. Virginia Kamova, Technical Expert, Menstrual Health and Hygiene, WSSCC, Geneva, Switzerland, to enlighten us on the topic. Over to you, madam.
Thank you very much. And thank you to all the organizers and all protocol observed. I feel very privileged to have been invited to this very important webinar. And I would like to first start with congratulating the college for the anniversary today. So very many congratulations. I've entitled my keynote today as Menstrual Health and Hygiene Management and All Season Natural Phenomena. The menstrual health and hygiene movement, as we all know, has now taken the world by storm. There is great momentum gained around the issue, and the movement has reached unstoppable levels now. And as most of us might already know, a couple of years ago, a Bollywood movie on periods won an Oscar. And menstruation now is talked about in very high, a lot of high places, including the United Nations Human Rights Council and other international forums. As some of you might know at the moment, globally, approximately 1.9 billion women, girls, and others who menstruate. And their calls to address the menstrual taboos and unmet menstrual needs have been receiving increased great global attention. Just to quote some statistics, across South Asia, a number of surveys have shown that the proportion of girls who do not know what menstruation is when they first experience it ranges from 36% in Bangladesh to 66% in Sri Lanka. And in India, 52% of girls do not have information about menstruation when they first experience it. Stigma and barriers related to menstrual health and hygiene still thrive in many settings around the world, despite all the momentum that the topic has gained. Inequitable social norms, discriminatory menstrual practices, and lack of attention to menstrual health and hygiene within sexual and reproductive health, education, WASH services significantly impact the economic and education opportunities, sexual and reproductive health education, as well as psychosocial well-being of people who face different barriers because of their menstruation or when they want to manage their menstruation. For example, I would like you to imagine a girl in Assam in India in 2020 during the flooding that hit Assam. This is a girl that has to navigate the emergency of the floods like everyone else in her community. And this girl has to think also about how to avoid being infected by COVID-19 during this period of the pandemic. But even though she, like everyone else, is facing these challenges, it's also time for her monthly period. Her challenges are compounded by the fact that her menstruation will not wait for the emergency to pass. She still needs to manage her menstruation under these difficult conditions. Just like all menstruators, she needs information about her menstruation. She needs to know how to safely manage it. She needs to think of, does she have access to sanitary materials, considering that she's in a flooding situation, but also there's a COVID pandemic? And what choices of sanitary materials does she have? And can she afford these different choices? And if not, does she and other menstruators know how to make cheaper and safe alternatives? How will they manage menstruation with dignity in confined spaces? Because with the flooding and maybe with COVID lockdown, they might be either in a camp or be in a small room with everyone else, like people that work during the day when it's not an emergency, they're all confined at home. So how does she manage her menstruation with dignity in such a situation? How about the persistent stigma that Dr. Krishna talked about the stigma associated with menstruation. How is she going to navigate that in a confined space? Does she have access to sanitation facilities where she can safely change her used materials, or any other private space where she can change? And is there water for washing hands and herself, or for washing reusable menstrual materials? How about discreet disposal of the materials that she's used? And how would she dry up the reusables in a discreet and dignified way? So as you can see, there are so many different challenges that people that menstruate face, but all hope is not lost. There are opportunities for action. And I think this webinar is also an opportunity to talk about those different opportunities for action in addressing menstrual health and hygiene management. There's need for systemic and radical changes to ensure that no menstruator is left behind. Be it those in vulnerable situations, like the girl that I've just talked about, who is faced with flooding, COVID-19 and confinement, be it those with disabilities, be it those in prisons, and all other menstruators wherever they might be. Dismantling taboos through education to break the silence around menstruation is very important. Education to adolescents, girls and boys alike, men and women, as Dr. Krishna mentioned, as well as government practitioners, teachers, and policymakers is very important. This education should include the busting of the menstruation myths and taboos that we talked about through provision of factual information, discussion about menstrual material choices and how they are used, and of course, specific disposal solutions. To do this, there's need to address stigmas and taboos related to menstruation by supporting grassroots advocates to increase influence among local and regional champions, and improving funding and attention for menstrual health and hygiene. And let me emphasize the importance of having champions. The people that have influence in the communities, if they champion and talk about menstruation, they will help in dismantling the taboos and stigmas, because these are people that are respected within their communities. We also have to think about how to innovate and create new range of menstrual products, especially now under COVID. Vinod G will talk about we'll talk about the recent documentation that they produced, which also talks about a range of menstrual products, and even those that can be made in different contexts, including during the COVID pandemic. And of course, we also have to talk about increased menstrual product access by fostering the development of markets for the products. But also during COVID, we have to think about affordability and access. And of course, when we talk of wash solutions, we also have to account for the needs of menstruators in design, and making sure that there are options for safe management, but also for safe disposal and reuse. And we have to think of also integrating MHH in a cross-sector of programs, including gender, health, education, sexual and reproductive health, and other programs. And this can be made possible also when we look at policies, the importance of making sure there's integration of MHH into various policies and strategies, but also have to make sure that the policies and strategies are accompanied by budgets, because without budgets, it'll be difficult to implement these policies and strategies. And we need a lot of research or to use available evidence that is based on advocacy. And we need collective and concerted efforts across all sectors, because MHH is a cross-sectoral issue. It's not just for one sector. It's for educators, it's for colleges like yours, it's for policymakers, it's for community members, and so on and so forth. And funding in the sanitation and hygiene sector is very, very important. Briefly, let me just talk about MHH at WSCC. WSCC has numerous efforts on MHH at different levels, including national, regional, and the global levels. At the national level, we provide policies support by working with national governments to transform existing policies and align them with targets 6.2 of the Sustainable Development Goals, but also realizing and recognizing the intersectionality of all the Sustainable Development Goals, especially those that I mentioned, like those on education, health, gender, and other goals. We also provide capacity building services, including training. And through that kind of work, we've built in India and elsewhere a cadre of senior trainers in menstrual health and hygiene who are available and provide training at different levels, including in local languages in India. And these are supported by the India Support Unit of the WSCC, which is led by Vinod G in India. And we also provide specialized initiatives like for visually impaired persons, for people with hearing impairment, and for people in different contexts, including in emergencies. And of course, we provide ongoing support to national and other partners. At the global level, we do a lot of work with different stakeholders. And as an example, recently, WSCC co-created with diverse stakeholders, the Global Menstrual Collective in March 2019, with a purpose of drive and guide investment in menstrual health and hygiene through evidence-based advocacy. And the collective has identified 4 strategic priorities, which are menstrual health and hygiene are incorporated into relevant policies, the availability and use of evidence to drive investment in menstrual health and hygiene is strengthened, to have a clear and strong public narrative for more and better investment in menstrual health, and also ensuring connection and collaboration across global menstrual health and hygiene, ensuring that it's strengthened and collective effort is enhanced. All I can say, having said everything that I've said, I would like to emphasize the point that specific investment in menstrual health and hygiene programming is very essential to realize human rights and full potential of all those people who menstruate, ensuring that no menstruator is left behind and no one is limited by menstruation. I thank you all.
Thank you very much, Madam, for the insightful keynote address. Now I would request today's key speaker, the crux of the webinar, Dr. Lakshmi Murthy, Additional Director, Jatan Sansthan, Udaipur, to address the webinar. Over to you, Madam.
Thank you. Good afternoon to everyone listening in. Namaste to all the co-panelists. A special thank you to Professor Kunur for bringing me on board. And thanks to all the people in the college who worked hard, perhaps, lots of backstage work to put this event together. Can I request Sunil ji, I think, to put the slide on? Thank you. So, yeah, thank you.
Yes, madam.
Yeah, thank you. I will sort of begin by speaking, 2 lines about my background. I have a design background, and I've worked in the area of reproductive health with adolescents, with communities, especially with non-literate communities for many years now. I used to have a design studio called Vikalp Design, and subsequently I merged it with Jatan Sanstha, the organization that I co-founded along with some other colleagues and friends. And I work now at Jatan Sanstha, and yes, so that's a little bit about myself. MHM is a very loaded term. And I have been working in this line since 1999. That's a really, really long time ago. And today what I'll do is try to paint a quick picture of what we've been doing and how we've approached menstruation over the years at Jatan Sansthan. So I will not speak too much about this slide. It speaks about the menstrual cycle, and it's enough to just summarize here by saying that you begin your menstruation during adolescence between 10 and 19 years of age, and then you get your periods in cycles and you bleed for about 40 years. And then finally there's menopause, when your complete menstrual cycle closes down. So a lot of this information comes from a school textbook for many people. And you read about it in class 8, class 9, class 10, and then the first-hand experiences of menstruation for a non-menstruator comes only much later in their adult life. So that is kind of the introduction of the menstrual cycle. And can we have the next slide, please? Okay, so how is menstruation different from all the human body expulsions? I like to use the word expulsion because continuously the human body is expelling many things. We have dandruff, we have dead hair, we have earwax. And if you look at this list, you will see that corporate companies, multinationals, they've made full use of it. For example, you'll have shampoos for managing your dandruff. You will have cotton buds for managing your earwax. You have tissue paper for managing, what comes out from your nose and so on. Now, most of these expulsions don't cause as much stress and embarrassment as menstruation causes. And why does this one body expulsion cause so much stress? This is what we will try to understand in the next few minutes. Seeing menstrual blood has never been socially acceptable. There's plenty of superstitions that go with menstruation. There are plenty of restrictions, and there's a lot of silence. And because of the silence, there are a lot of code words. So I know people who have recorded up to 500, 600 code words for the word menstruation. And way back in 1999, when I started this work, even saying the word menstruation was seen as very difficult and very taxing. And suddenly that scenario has now changed. So let's see what else has been happening. So can we look at slide 4, please? Because menstruation has to be managed, see, it's different from urination and defecation, because you will go to a washroom and you will urinate and you will defecate. Where menstruation is concerned, it's a continuous kind of management that you need, because the flow is absolutely involuntary. So how would you manage this flow? Very simply, it can be divided into two sections: reusable devices and disposable devices. So if you look at on the reusable side, cloth and fabric has always been used for centuries. And cloth has typically been harvested from old clothes, saris, dhotis, turbans, and bed linen. And you will have variations of cloth, which I've shown you in the other pictures, which we'll also talk about later. And on the other side, you have disposable pads. So you have this gauze surgical cotton pad that you make, that many women, many menstruators make at home. And the pad with the belt is a clip pad that we started getting in India in the 70s. And I remember using this kind of pad for most of my life. It came with a belt, it had no adhesive. And suddenly in the 80s came the concept of adhesive, where you could then paste your sanitary napkin onto your underwear. And then when the wings came into picture, there was no looking back. Wings kind of protected you from all kinds of leaks and managed you very well. The introduction of gel and other chemicals into a sanitary napkin made the pad very thin. So now today you have paper thin pads as opposed to the pads in the 1970s, which I previously just described to you. So if you look at all these products, these are absorbents that you would wear outside the body. Now inside the absorbent, there are some devices you would wear inside the body. For example, the sponge will absorb your menstrual blood, and then you will remove it and you will wash it and you will wear it again. The cup, on the other hand, does not absorb, it's a collector. So it collects your menstrual blood, and then you can go to the latrine or go to the commode and you will tip the cup out, and then you'll wash it and you can insert it back into your vaginal canal. I heard this afternoon that your college started in 1930. The cup was designed as early as 1930. It was patented in 1930 in the US. Similarly, if you look at the tampon too was patented as way back as 1930. So the tampon too is an insertable device, but this is a device that has to be disposed. You wear it for a few hours and you dispose it. All these products come with advantages and disadvantages. But so far, the one product that has worked forever and ever for women has been cloth. So I will be speaking a lot about cloth. Now, on the top of the slide, I have also said two words, isolation and free flow. Isolation was a method that was used many years ago. It is still prevalent in Nepal. It's still prevalent in some parts of Bihar and Uttarakhand, where women or menstruators separate themselves from the rest of the community, and they go into a separate hut or a room, and they stay in this room for 3 days, and then they come back to the family after their menstruation is over. So isolation was one way menstruation used to be managed, and isolation took on many forms in the modern context. Isolation meant that you don't go to the kitchen, as previously Dr. Krishna was saying. So the system of isolation has given rise to other forms of isolation in the modern context. If we look at the word free flow, which I've said, this is a method that many women still use. It means wearing nothing. It just means allowing the blood to freely flow. And the word became popular recently because there was a London marathon runner who used the free flow method to complete her marathon race. So that's a little bit about how menstruation is managed. Can we have the next slide, please? Okay, so what are some ground realities for us? In the areas where I have been working in South Rajasthan especially, see, a lot of these things keep changing, but let us just say that if I go to the field today, I will find these ground realities. For example, families will have a toilet, families can access, because of the Swachh Bharat, various efforts from the Swachh Bharat, you will have toilets, but really speaking, are they in use? No, because sometimes, it's a lot of effort to fill water in the toilet. So families will just lock up the toilet or use the toilet to store their grain and so on. So you still will need to go out into the jungle to manage your needs, or perhaps you will change your menstrual product in your bedroom at home. You'll ask the men folk to leave and then you'll change your menstrual product. At school, you may have clogged toilets, you may have latrines that are not usable. So it's very convenient then to naturally stay at home during these 3 days. So you might find absenteeism from school during your periods, but it's not. And adolescent girls are absent for many other reasons, and probably this is one of them. On the left, you'll see an adolescent girl washing her menstrual cloth. Now she has a clean cemented space to wash her cloth, but that is not always so. So you can see it can be quite unhygienic. It can be quite a dirty spot full of slime. But whatever it is, however well you wash your cloth, finally it is hung under a petticoat, under a salwar kameez, under a larger garment, because there are a lot of superstitions around seeing menstrual cloth. It is believed that if men see menstrual cloth, they will go blind. Or there are n number of superstitions across India. It's not just in Rajasthan, where I have primarily based my work. Once you are done with your period, once your menstrual cloth has to be stored, typically it is stored among cow dung cakes. And this is the area where men do not visit, because the cow dung management is always done by women. And so it's a safe place to store your menstrual cloth. So really speaking, cloth as such is not hygienic. Cloth becomes unhygienic if you've not washed it properly and hung it out in the sun to sterilize. Sun is very important for cloth. And finally, when you store it, you have to store it in a somewhat hygienic way. Put it away in a bag, in a proper cupboard, and not stuffed as you are seeing it stuffed here, which is a very common way of storage. So can we have the next slide, please? So summarizing some ground realities, I have spoken about code words. I've spoken about the silence around menstruation, superstitions, practice, isolation. And now there is this notion that menstrual blood is dirty, menstrual blood is associated with pollution. And very unfortunately, our religion has not supported menstruators. Many religions do not view menstruation as a scientific occurrence. Newer religions like the Sikh religion have very liberal views on menstruation. For example, they have no restrictions about visiting a gurdwara. So the newer religions, I will emphasize, look at menstruation in a more scientific manner. And of course, there is very little involvement of men. If men had been involved, perhaps we would have had better bathrooms, perhaps we would have better facilities for managing menstruation. So I ask, I would, propose two questions: that have women excluded men from menstrual conversations? Or is it that men have excluded themselves, feeling that it's not their business? So it's a mix of different kind of realities we work with in the area of menstrual health management. So can we have the next slide, please? So what are other ground realities for us who are working in the field? So the movement is from cloth to timepiece to a disposable pad. Now I'll describe timepiece to you. Timepiece is a piece of flannel. It's a fabric flannel, which is very commonly available in North India. And it's very inexpensive. It dries very quickly. You can wash it and wear it, and it lasts for about 3 months. So it's extremely popular with women. But the negative of this timepiece is that it gives you boils, it gives you rashes, and it's a very warm product. So imagine in 45-degree heat, you're wearing something, that makes you even more warm, and that is not good for your vaginal area. So having said that, if I go back to cotton cloth is cool to the skin, it's biodegradable, it has no load on the landfill, but yes, it comes with one disadvantage, that you have to wash it, and wash it very well. Now, when women select cloths for their menstrual cycle, they select a dark colored cloth, again, for the same reason that stains should not be seen, men should not see the stains. So what happens when you wear a dark colored cloth? You are unable to identify the color of the discharge. So if your discharge is pink, green, or yellow, these are indicators of an infection. So you never get to see if something is wrong with your body. So these are the negatives of cloth. If one used a white or a light colored cloth, and if one washed it well, and if one hung that out in the sun and maintained it nicely, cloth causes absolutely no problem. It's the most hygienic thing you can think about, but you have to manage it well. It's like wearing an underwear. We all wear an underwear every day, which is made of cotton cloth. But somehow media has us believe that disposable is the best, which is not really so. And if we look at the numbers, you put some numbers out for you to see. So in a lifetime, probably in a 40-year period, 40-year lifetime of periods, you would throw away for more than 4,500 disposable pads if anyone were to use only disposable pads. If you would use recyclable products, the number would be far lesser. So can we move to the next slide, please? So really, what is this fuss about disposable pads, and why are we fussing so much at Jatan? We're fussing because it's completely full of plastic. It has, it's 90% plastic. I mean, 90% is a percentage that I'm using randomly. But if you look at a lot of studies, they will tell you about each component in a sanitary napkin, right from the top sheet up to the adhesive. And as I mentioned earlier, gel is a critical component here. And the minute you introduce gel, it's able to absorb 30 times its weight of liquid. And because it's able to absorb so much, you can make your sanitary napkin as thin as you can. So a number of times we need to look at the raw materials that go into the absorbent that we are wearing as menstruators. So I won't dwell much on the slide, and can we please go to the next slide? And now what is happening to the disposable pads? They get clogged in sewers and drains. Unfortunately, the poorest of the poor are the people who, manage and unclog our drains for us. And, as you can see, it finally goes into the landfill. So if you look at, I've just given you two quick examples. In an NGO, Swachha in Bengaluru is estimating 800 tons of sanitary napkin and diaper waste every other day in and around Bangalore. And in my city where I live, even 100 households can generate as much as 8 kilos of sanitary waste. And 8 kilos, mind you, might look small, but no, it's not small, because sanitary waste, adult diapers, sanitary napkins, children's diapers, they're actually lightweight, but in terms of volumes, it's huge. And today it's lying there absolutely in an undegraded condition, because plastics do not biodegrade. They only disintegrate into small micro granules, and the small micro granules go into the soil and finally go into the water that we are drinking. We all know the we all know about plastics and what happens to plastics after that. And this is what happens to disposable pads. And that's the reason sometimes we push. In fact, I won't use the word sometimes. We all the time try to push for cloth pads. But yes, cloth pads do have a couple of disadvantages, which I said to you earlier. So can we have the next slide, please? So at Jatan, what we've done is we have decided, we decided very early that we have to look at four components. What are these four components? One, we have to create awareness and break silence, and we have to include men at all stages of menstruation work. We have to give our users informed choices. We've got to tell our users that this is the menu, this is what is available, and you decide what you want to use. And these are the advantages or disadvantages of these products. Having said that, we also designed an absorbent, which is a pad, which is a cloth pad, and we included components of how to stitch your own cloth pad. And as we moved further in our work, we also now help people to set up production units. So can we have slide 11? So what do we really do? So we have training programs, and just sharing with you some examples. We have trainers who are both men and women, who are equally proficient in dissemination and delivery, because we believe that men are a very important part of our campaign, are a very important part of our movement. And because I have a design background, a lot of times we rely on very well designed and very well tested media material. So I'll show you in the next few slides what this media material is. Can we go to the next slide, please? Okay, so we have a menstrual kit with a whole lot of products, and you will notice here we even have an underwear in our menstrual kit, because we have to teach young menstruators how to place a pad into their underwear. We also have pad samples, which we also have pad designs where you don't need an underwear, because many women in our communities do not wear an underwear. They will wear cloth with a nada, like a langoti. So we have a variety of these products, and we make sure that in our workshops, everyone has seen whatever there is to be seen, and then they are the ones who finally decide what they would like to use. So can we go to slide 13? So this is an example of one of the materials that we use. We don't begin with straight away speaking about what is menstrual health. We talk about adolescence, we talk about changes in the body as we grow, and it's just not girls who have a major body change, it's also the boys. Very few people talk about night emission or wet dreams. At Jatan, we've spoken about night emission and wet dreams since 1999, because we've had our groups informally formed, as early as 99. And so we try to make this as gender equal as possible. If boys are going through some kind of stress over changes in the body, the girls too are going through some kind of stress. So this is what we use as part of our communication, and we call this the covered book, and the book unfolds with many layers. So can we have the next slide, please? We have some other products. For example, nutrition, for example, is a very important component of menstruation. And how is nutrition communicated to communities, especially to non-literate communities? It's very complicated when you have to tell a bunch of young adolescent girls who've never been to school what is food pyramid, and what is a vitamin, and what is a carbohydrate, and what is a fat. We simply say, make sure that your meal has the 3 colors of the national flag. So when you say that, all the colors come into your food, as you can see on the left. So this is the kind of way that we innovate when we need to communicate. So we have in the middle, if those of you who can read Hindi, it says Mahavari Chakka, or the menstrual cycle. This too was designed way back in 2000 as part of one of my fellowships. And the product is still in use 20 years later. So it's also a question about how sustainable your designs are, how well you field test, and how well you design your communication material. We have training manuals that we give out to people who we need to train when they need to start their own production units to different women's groups. So this is a little sample of what we have in our kit. The next slide, please. So our pad, this is what our pad looks like. Our pad is called Uger. Uger, while the spelling is U-G-E-R, and everybody thinks it's probably Ugar to rhyme with Uber, but that's not so. It's Ugair. And Ugair is a word in Mewari. Mewari is a language that is spoken in South Rajasthan. And it means a new beginning. It means a new beginning. So we see Ugair as a new beginning in the way we look at menstruation. And this pad has been designed using the 4 pillars of sustainability, which is environment, economic, health, and social. We've made sure that all these 4 pillars of sustainability have gone into the design when we made the pad. So we have essentially two types of pads. One is a pad for light flow, and the other is a pad for heavy flow. In the heavy flow pad, you have 2 straps, and your cloth can be placed very nicely and comfortably into the 2 straps. Next slide, please. And this is a little picture of how you would snap it on and place it on into your underwear. What are the different layers that go into the pad, and how would you hang it eventually? So these have been extensively tested, because I also did this as part of one of my PhD research. And we can guarantee that a pad like this can be washed and reused up to 60 times. Yes, the pad will not look white after, say, 10 washes, but that's not harmful. It will have a slight brown color, but that's all right, because it's cotton, it's healthy for you, it won't give you rashes, it's cool to the skin, and most importantly, it doesn't cause any menstrual debris. And you're helping the environment and helping yourself if you're using any product that is made of cotton fabric. The next slide, please. So as part of the work we do, we teach whoever wants to learn how to make the cloth pad. We especially encourage men to stitch a pad and gift it to somebody they love. It could be a sister, it could be wife, it could be grandma, it could be cousin, it could be girlfriend. But when you make a pad for somebody you love, you are in solidarity with a menstruator. So that is the concept of how and why we've always felt the role of men is critical. And we're grateful to all the men who came forward 20 years ago, 30 years ago. When I started this work, people thought I was crazy. And my husband, who's unfortunately no more, was the one who really supported my early work. And Kailash Bijwasi, who's sitting next to me, who is the CEO of Jatan, he didn't think I was talking nonsense. So men need to understand and help us move along in the journeys that we take. So can we have the next slide, please? Right. So now we keep our work in the copyleft space. And so we're very, very happy when people pick up some of the things we've done and reprint it and reproduce it. So Mishraji in the audience will know this very well, because he was very involved when the menstrual wheel and some other products were taken and put into the curriculum of WSCC. And very kindly, WSCC has given me credit for that. And really, thank you very much. I had said thank you at that time, and I'll say it again. So it's now in 4 languages. It's been there for a while. You can find it on the WSCC website. It's in Chinese, it's in French, English, and it's in Hindi. WaterAid, for example, picked up our design, and they have distributed this pamphlet in MP where they're working. And probably Lara will tell you a little bit later when she speaks about the. I think they have also now reprinted, or I'm not very sure. Lara can clarify at a later point whether Tata Trust has reprinted our nutrition flag material. So we'll talk about that later. So can we have the next slide, please? So outreach happens only with collaborations. So previously I spoke about a copy left, and now I'll just speak about how it's only when you collaborate you can take your work further. So we've worked with Steiner and IIT Madras. Steiner is a science and technology initiative for the Northeast region. This is a government initiative, and we've worked with both these groups. We worked with the Northeast government, and we set up 4 production units in the 4 states, which you can read on the top: Manipur, Meghalaya, Assam, and Arunachal Pradesh. So really speaking, what have these SHG groups done? What have these self-help groups done? They the government has given them money to buy the machines. They're making the pads. And where are they selling the pads? In the local market, as you can see. It's a simple poster they've made in paper, more pads, and then they're selling it in the local Haat Bazaar. So really speaking, it's a very large effort, but at the same time, it's not too complicated. You can just move ahead beautifully with simple designs and simple strategies. We have, of course, a cascade model where we're teaching the first bunch of master trainers, and they in turn train others, and it goes on like that. So these are two examples of our outreach that we do. Of course, we've also worked for aspirational districts in Bihar and Jharkhand. So I mean, of course, the presentation can go on. I'll try to keep it very quick now. I think we're also running out of time. So can we go to the next slide, please? Okay, so for us, outreach is also meant sale and diversification. So we have sanitary napkins, we've got panty liners, we make nappies, masks, scrub caps, baker's caps, and salter pans. And masks, of course, has been a more recent one because of the COVID, in response to COVID. And primarily, we were in the containment zone ourselves. So even during the containment zone, containment time during COVID, we still managed to get cloth to reach our 20 women who were making masks, because masks come under essential service. So we managed to get a permit, and we would make sure that the cloth reached these women into their homes, and they would stitch the mask and send it back to us. So we've been through a bit of a strategy change while we were working during COVID. We still are, combating COVID as everybody else is. And all these products are products that are environmental friendly. For example, the black baker's cap that you see, we've supplied them to local bakeries here, because the bakers used to be wearing a cap which was made of, the plastic cap, the non-woven polymer cap. So we convinced them that, you must look at reusable caps. Scrub caps are the caps that surgeons wear. So we are supplying to some clinics over here. And of course, you can see a little baby wearing a Ugair nappy, which we are very proud of. The pink underwear-like thing that you see on the right, these are called salter pants. And salter pants are, you put a little baby inside it, and then you wear the baby. So these two often are made of plastic materials. So we are trying very hard to replace materials that are made of plastic in the efforts that we do at Jatan. So we're almost near the end. So can we have the next slide, please? So I'd just like to summarize a few things that I've said. We've seen all the ground realities. We have understood that menstrual blood is certainly not dirty. It gives life. The same blood is in your uterus for 9 months, and it's nurturing and looking after your growing baby. Do take action if you have rashes from the menstrual product that you're using, and never be afraid to switch to cotton cloth. It's best. But take action if you notice anything, that is, if you notice your discharge, if it's colored differently, because then you need to get yourself some kind of medication, and then of course you will get well. But then don't let it come to that. There are many products for menstruation management, so make those informed choices. Dry your menstrual cloth very well. There are many issues around sustainability. Consider all these issues. Correct information needs to be shared. Collectively, we all need to break silence, and definitely we need to include men. If we leave men out of our lives, then we've had it. Of course, if copy left is possible for you, you have to try and make everything that you do copy left. So there is a very, very well-known designer called Victor Papanik in the 70s. He said that if you are sitting around waiting for copyright and waiting for registration, then it doesn't benefit anybody. So just go ahead and put your things out there for people to use. And in that regard, I'm very grateful again to organizations like WSCC or Tata Trust and WaterAid, who've seen the things that we've done, and they've never been afraid to say that, okay, something has been designed and let's take it forward. There's no sense reinventing a wheel and wasting time. So I have written something for you in red. It's called the PASS tool. This is a tool that we have developed for measuring sustainability, and it's a scoring tool. So if for anyone who's later interested, they can connect back with us, and I'm happy to share on the email how the how the score tool works. You can use the score tool for a cloth pad. You can use a score tool for a disposable pad, for a menstrual cup, and it'll give you a score. Say something will give you a score of 3, something will give you a score of 2, and something will give you a score of 1. And then you can decide what is sustainable for me. So this is maybe for a later, a later point. So can we have the next slide? I think we are almost at the end. And yes, we are at the end. And right at the end, thank you for listening. And I think we all need to work together to have a sustainable and healthy period. You can write to us. You can look at our website. A lot of our things are already on the website for you all to see. And if anyone wants to connect with us, collaborate with Jatan Sansthan, most welcome. And I especially welcome students to write in with their questions. Thank you.
Thank you, madam, for the informative session. Now I call upon today's guest of honor, Shri Vinod Mishra, India Coordinator, WSSC, to render words of wisdom. Over to you, sir.
Sir, please unmute yourself, sir. Vinod, sir. Please unmute, sir.
Vinod, sir.
Vinod, sir. Vinod, sir. Please unmute yourself, sir.
It's okay?
Yes.
Okay.
Yes.
So good afternoon, everyone. Thank you very much, Geeta, for giving opportunity, and Kannur for organizing this excellent webinar on the menstrual health and hygiene. I'm grateful to the Geeta and Virginia for the participation and giving their inputs. So already Virginia has covered the many things, and after Lakshmi, nobody can speak about menstrual health and hygiene. She's a master, she's a PhD, and she has a around 40-50 years long experience on the MHH. So I will cover 2-3 points. First thing that if you see the importance of the menstrual health and hygiene, it's so important. It's not about only girls and the women. Actually, it's about our entire development. If we see the sustainable development goal, so out of 17 goals, 5 goals directly related to the menstrual health and hygiene. Goal number 3 about the good health and well-being is directly related to the health of girls and women. If we will not able to do the menstrual health and hygiene, we cannot achieve goal 3 in the sustainable development goal. Goal number 4 is about the quality of education. So globally, there is evidence of reduction of attendance from the school dropout of the girls because of the poor management of the menstrual health and hygiene, and about the correct information and especially facilities in the schools for the girls, for the privacy, for the changing the pad. So if you want to achieve the goal quality education, goal number 4, we will have to work on the menstrual health and hygiene. Goal number 5 is gender equality, and the denial of reproductive health rights exacerbates the poverty and gender equality. So for this, we will have to work on the menstrual health and hygiene. Goal number 6 is related directly with the clean water and sanitation, is addressing specific needs of women and girls, those who are living in the vulnerable condition, and so for them the teaching and awareness about menstrual health and hygiene is so important. If you see the goal number 10 about addressing inequality, so for this also, if you will not able to address the problem of menstrual health hygiene, we cannot achieve the SDG. Under WSSCC, Virginia has given input, but we are working on 3-pronged. Our approach is very holistic, that all Virginia has explained and Lakshmi has explained the all 3-pronged. But I will emphasize again about the three prong. The first is the breaking the silence, the talking about the taboos, talking about the misconception, talking about the feeling within the society, and especially silence in the society, silence in the home, silence at large in the society. Nobody is talking about the menstruation. Everybody is talking about the all the human body parts, but nobody is talking about the menstruation. Even the father cannot speak to own daughter, the brother cannot speak to sister, teacher cannot speak in the classroom. So we will have to break these taboos and silence, so that everyone should speak freely. And any girl, especially adolescent girls, when they need the most education, at that time they can speak freely to her mother, to her father, to her sister about the menstruation, how to manage it. So breaking the silence is the first pillar. Second is managing menstruation hygienically. This is very, very important. And already Lakshmi Murthy has explained how to manage menstruation hygienically. She has explained the different type of absorbent, the uses of different absorbent, the disposal of absorbent, how to clean it, how to maintain it, how to reuse it, how to dispose it. So this is very, very important. And other than absorbent, I would like to give a push around the facilities of wash facilities at public places, railway station, bus stand, hotels, and especially in the workplace, in the offices. If you go in the ladies' washroom, we will have to make some arrangement there where lady can dispose easily, can change pad, and can wash her hand with the proper soap and liquid material. So that type of facilities we will have to do the awareness and the capacity building in the society, so that everyone should aware about the menstruation and managing menstruation hygienically. The third pillar is safe reuse and disposal of different absorbent and solutions. Already Lakshmi Murthy has explained different type of solutions. So which solution is fit for us, and which solution need a proper disposal, or how can you reuse it, dry it, wash it, and reuse it. So regarding the absorbent and solution, we will have to aware and build the capacity. So these are the three pillars: the breaking the silence, managing menstruation hygienically, and safe and reuse of disposal solution. These are the three big pillars, and our all learning materials, training materials are based on the three pillars. I am so grateful to the Lakshmi Murthy. She supported a lot, and she has prepared actually our flip book and the wheel. She has already shown the picture of wheel. We have developed the flip book also, and we are using in India at different places. In India, as a WSSC India coordinator and the WSSC our Geneva office, actually we are working in 7 areas, especially in India. First is the policy support. Under policy support, we supported Government of India under Swachh Bharat Mission, even before Swachh Bharat Mission during Nirmal Bharat Yatra, for the inclusion of menstruation in the national guideline. And I'm happy and glad to share that the Government of India has included menstruation as a big part under Swachh Bharat Mission, before that under Nirmal Bharat Yatra mission. And now, the 1st June 2020, Government of India launched the Swachh Bharat Mission Phase 2 under ODF Plus. If you see the guideline under solid liquid waste management and awareness IEC part, there is a big part of menstruation, and all states and districts, they are working on menstrual health and hygiene. This is the contribution from the WSSCC. Second is we are working in the 4 states, UP, Bihar, Jharkhand, and Assam. We supported the state government to develop proper implementation plan on menstrual health and hygiene. And I'm happy to share that the Bihar, Jharkhand, and Assam has already published the implementation guideline. we are supporting these states in rolling out this implementation plan at grassroots level. We organize the campaign and different type of yatra to aware the community, especially adolescent girls and women, about the menstrual health and hygiene, to breaking the taboo and silence. So that activity is still going on. Third part is capacity building. WSSC has developed 5 days training module. We are creating master trainers at different places, and I love to support Seshadri Education Trust. If you will give the opportunity, we have the 45 master trainer at national level, those who are empaneled in Government of India. We can deploy them, and we can organize the proper training of trainers in your educational trust, and we can create master trainers, and we have the training material in Hindi and English. Whatever you want, we can provide Hindi, English, any training material to Seshadri Educational Trust. Then you can carry forward in your whole entire network. The fourth thing is research. We have commissioned research on the menstrual health hygiene and in Odisha, in Maharashtra, in Gujarat, in Rajasthan, and Uttar Pradesh. And basis on that research outcomes, we prepared our training and teaching materials. Recently, just 2 years back, with the support of Government of India and Indian Institute of Technology, IIT New Delhi, we developed tactile book, the material in the sign language, and tactile book for the blind people who cannot see. They can use that material easily in the Braille lipi. So Braille script, we have that entire material, so we can provide that material to anyone. And I love to support Seshadri Educational Trust. If you want to train your people in the Braille script for the blind people and for the sign language, that material also we have. And for the living one behind, we are reaching to the most vulnerable people in India. We have created a national alliance with the Global Interfaith Alliance. Is based in Rishikesh, and this alliance is coordinating with the different faiths, Hindu, Muslim, Christian, Sikh, and many others in India. So breaking the silence in the religious community is most important, because they are not giving access to the women and girls during menstruation in the temple. And a lot of noise happening around the Kerala temple, you all know. But we are advocating, and this case is already Supreme Court has given verdict that you cannot stop anyone entering in the temple. Now we are the case is again with the 7 judges bench, high bench, and we are trying to do the advocacy that Supreme Court should give the clearance that every women can get access to the temple. And for this, we created a national alliance with the Global Interfaith WAS Alliance, and this is based at Rishikesh. So we are working with the religious people and created national alliance. We have created an alliance with the Youth Ki Awaaz. Youth Ki Awaaz is an organization based in Noida, close to New Delhi. They are working with the youth people, doing awareness, doing city session. So we are supporting Youth Ki Awaaz and Global Interfaith WAS Alliance to creating the mass campaign and national alliance. So these work we are working in India. I will not take much time because Lakshmi Murthy has covered all the point. But again, I'm happy to and grateful to Connor for giving this opportunity and collaborating with us for this webinar. And we are happily and I'm glad to support Seshadri, this educational trust, and Jatan Trust is already our partner. So thank you very much to all participants. Thanks for listening.
Thank you, sir, for your words of expertise. Now I call upon one more guest of honor, Ms. Lara Gulia, Senior Executive, Tata Trust, to share her views.
Thank you so much, Geeta. I'd like to thank Professor Dhireppa for having us here. And of course, it's it's an honest, I'm very grateful to be able to speak here with Lakshmi ma'am, because Lakshmi ma'am has been part of our program from the very beginning and has helped us shape it to what it is today. And it was very good to hear what Virginia and Mr. Vinod spoke about. Thank you for that. So I would just, since mostly all the things that are important have been covered, I will just try to talk a little bit about how all the learnings that for the last 30, 40 years, Lakshmi ma'am has been working on, etc. How in 2016, we collaborated all of this information and from a lot of organizations working in India, and we tried to start a menstrual hygiene management program at the Tata Trust. So I'll just talk to you about that in 5 minutes. So in the Tata Trust, we have a vertical called the Tata Water Mission, which primarily works on water, sanitation, and hygiene. And while we were working with the Swachh Bharat on constructing toilets, etc., we realized that there was a need for women because there were no facilities available to women with regard to their menstruation. So in 2016, we decided to start 2 pilots. We did one pilot in Uttarakhand, which was a hilly terrain and a different kind of a group. And we did one small project in Rajasthan, where we worked with Lakshmi ma'am and her team, as well as some other organizations. We had a lot of learnings from those 2 pilots in 2 states. And then we started our program in 2017, which we started working in 8 states. We've covered approximately more than 120,000 women and girls in the last 2 years. So I'll just, that like everyone has pointed out, there are 4 primary, very important pillars in the MHM value chain. One is awareness, because awareness is key to making any informed decisions. Second is access, which means ensuring that there is access to whatever facilities we are talking about. Third is usage, and fourth is disposal. So like Lakshmi ma'am also pointed out, one single sanitary napkin takes 800 years to actually biodegrade. And we are generating 120 crore kgs of sanitary napkin waste in India every year. So of course, sanitary napkins is a huge issue. We need to find alternatives to deal with it. There are incinerators, etc., which are working on burning the sanitary napkin, but incinerators are required to work at 800 to 900 degrees Celsius. Most of the incinerators that are available today are working at 200 to 300 degrees Celsius, which is not meeting the required criteria, which is primarily breaking the plastic into smaller plastic, which is even more harmful for the environment. So of course, we have to look at alternative ways to continue to treat the sanitary napkin, which has already become an existing practice, as well as promote reusables wherever we can. So based on a lot of understanding that we had, in 2016, we started working on this project. So we realized that nobody had actually spoken about periods before. So when we entered the villages for the first time, we were actually pushed away. They said, what are you coming here to talk about? Menstruation is not a thing in Uttarakhand. I was myself asked to leave 2-3 villages because they didn't want to talk about something like periods. So then we realized that it's a much larger issue. And we focused a lot on actually building a trusting relationship with the community, and then creating a safe space for women to actually feel comfortable to even talk about it, which was a very, very big part of our project. So once we started doing that, then we slowly started working with groups of small women, groups of small girls, and we touched upon various aspects. So I just want to highlight some key points here, which would be a little bit more information than what the other speakers have already spoken about. So like, we first create a safe space. Then we started talking to them about actually sharing our first period story. So that actually helped bring about a connect with people. So people started wanting to realize that everybody had gone through a similar situation. Most girls, if you ask them even today, maybe there'll be a lot of people here as well, we were not aware about menstruation before our first period. So the first time we got our period, we were scared. We were so scared that we didn't know what was happening. We were just bleeding from a place which we were not even allowed to speak about. So these are situations which were across the country. In 8 states, we've seen many people have similar situations. So it was important to touch upon that aspect. Then we start talking to them about, women are not aware about how many holes there are. People don't know if the vagina and if the menstrual blood and urine are coming out from the same opening or not. So it was very important to talk about women and their own bodies. So we started talking, once we created the safe space, we shared our first period stories. We started talking about the actual anatomy, the reproductive cycle, what the ovaries are, which is primarily to establish the fact that the blood which comes out during menstruation is the same blood which gives nourishment to the fetus in the uterus. So how is that blood impure if the same blood is giving nourishment to the fetus when it's inside the uterus for such a long time? So once we establish that fact, then slowly we move on to other aspects. So second, we have 4 or 5 interactions with them. So first session I spoke about. Second session, we primarily talk about products, all possible products. Our focus is that women should make an informed choice. It should, if I want to choose a pad, if I want to choose a cloth, it's my choice and I know about everything that is available. So it's the same way we wanted to produce every possible thing. We discussed cloth, sanitary napkins, there are other reusables as well. We discussed the pros and cons for every, and let the woman actually make a decision about what it is that she wants to use, what it is that her body and she's comfortable using. So products was a very important part. Then we talk about nutrition, and yes, ma'am, we've actually used the nutrition tool, and it's been working really well, because otherwise, when we are talking to women about all the kind of nutrition you should eat, the nutrition flag, when you tell them right away, it should be orange, white, and green. It has a direct recall, and it's very, very effective so far. We've actually got women having in some communities on menstrual hygiene day, we had women who actually celebrated a nutrition feast. So they actually prepared orange, white, green, all kinds of food, and we had that as a celebration this year. So yes, nutrition is another aspect that we have to touch upon. PMS is also a very important part, because PMS is something that happens to everyone, but nobody knows about it, because of which a lot of stress is actually induced on the women. So actually making women aware about what PMS is. PMS is premenstrual syndrome, which is primarily 1 week before there are certain symptoms before your period which go through. So we actually talked to them about PMS, talked to them about how they can, and PMS has physical and mental symptoms both. So both can be handled very well. So we talk about that. Then the third session, we actually talk about a very important point, which Mr. Vinod also just mentioned, was about the myths. So there are many, many myths. The myths range from not entering a temple to not watering the plants to not touching water, not cooking, not washing your hair. Every village will have their own set of myths. And these are all actually primarily started with something small, but over the generations and generations, they've been misunderstood and negative things have come in, and they've been made to be things that are associating women with untouchability or other certain things. So we actually have a very engaging 1.5 hour session with our community women, where we talk to them about each and every myth that they practice. And we actually go into the scientific reason of why that myth may have originated in the first place. And we focus on, our emphasis of the module is to actually encourage women on critical thinking. So if they don't go to the temple, fine, we're not forcing you to go to a temple, but you should know why you are not going to the temple. And then you should make a decision about whether you still want to or you don't want to go to a temple. Similarly for all other aspects. So it's very, very important to actually encourage critical thinking by providing scientific knowledge about aspects of it. And then the next session, we focus a lot upon actually breaking the silence and encouraging conversation. So how a woman should talk to her husband. We do role plays with them to actually see what are the different ways they can approach their husbands, how are the different ways their husbands may react. We talk to them about how women should talk to their daughters before menstruation, before she gets her first period, so she doesn't get scarred the way the mother had. Most women would have had a scary experience. We talk to women about educating boys about it, because boys are going to become the men in the future, and they would have their own wives or sisters, etc., and they'll be able to provide a supportive socio-cultural environment. So we have a varied as ranges of topics we touch upon with women. And similarly, we also work with girls, adolescent girls in schools. We also work with adolescent boys in school, where we've worked very closely with Jatan and Lakshmi ma'am's team. We also work with something we started new, which we are still piloting, is working with couples as a unit. So actually getting the husband and wife together, educating them about various aspects, and helping them. So to provide that socio-cultural, supportive socio-cultural environment, etc. So we actually bring them together, and we've had amazing results in Rajasthan, in Gujarat. Husbands have got toilets made, husbands have made stitched cloth pads. Also they have, actually there was this one couple who came all the way to Bombay, and this husband from a Gracia community, interior village, he was talking about how he's going to go back and pioneer this entire aspect of getting more men involved. And his wife was suffering from an illness for the last 10 years. He came here, he got her treated. So there is a lot of things that can happen when men can actually be a part of this as well. So these were some aspects with regard to our module in terms of awareness, and behavior change is a very key thing we focus. So we've identified for women and girls 7 essential behaviors regarding menstruation, right from drying your cloth in sunlight to changing your pad 4 times a day, washing your hands with soap after changing your absorbent. So we have a list of 7 behaviors, and we push behavior change through a very psychological theory, change of theory perspective, and we trigger these 7 behaviors because hygiene is key. Now, given the COVID pandemic that has unfortunately come on top, it's a reality that we're all dealing with. Hygiene has become paramount, and be it right from hand washing to surface hygiene, etc. So menstrual hygiene also has taken some more importance in this given scenario. And what we realized is that since the lockdown in India, most of the people into production of sanitary napkins or cloth pads, etc., they are all working at 25 to 50% production capacity, which means that the girls who were actually, there are various government schemes which are providing sanitary napkins to girls in schools as per the government scheme. Those are also not continuing right now because there is no production happening. So schools are shut, there is no supply of any absorbents. So there was a huge gap in the menstrual absorbents that was there. So we, again, with the GAIR's and Jatan Sansthan's knowledge, as our knowledge partner, we've gone ahead and we've promoted cloth pad stitching at scale. So we've had almost 25,000 women over the last 2 months stitching cloth pads for themselves. We've also developed certain animation videos and videos on how you can stitch your own cloth pad at home. So we've disseminated that during the lockdown at scale. We had a lot of people stitching across from Assam to Karnataka. We had Gujarat, Uttarakhand, everywhere women were stitching their cloth pads. Now we've realized that the gap is still existing. So we're also looking at stitching cloth pads locally through SNGs and ensuring that women in communities have access to that. So there are a range of activities that we've been doing with regard to menstrual hygiene. And of course, in the last 5-6 years, it's become a very important subject. Women's health, menstrual health has become a very, very important subject. And it is, like I always tell you, ma'am, it's because of all the effort that you have done in the last 20 years that we've been able to now push it to this stage. And yes, I think there's been a lot of the absorbency at the ground level has also been really, really great. Once women are actually given the information about their bodies, about products, about themselves, they will do everything that they can to ensure hygiene, to ensure their health, etc. So another thing that we are promoting is health-seeking behavior. That is actually push women who may have UTIs or RTIs, and again, they are things which are hidden, never spoken about, get the right treatment for the same thing. So there are amazing results on that. I just want to share one story which I think would be important for everyone here. There have been various myths, etc., in the communities we've come across in the last 4 years. One thing which has really struck me is that in Assam, there were women we came across in 5 villages who were taking oral birth control pills continuously for 2 years at a stretch. The reason being that they did not want to have their period. So when you take oral birth control, you don't bleed till the time you take birth control. These girls and women were taking birth control for 2 years at a stretch so that they don't bleed and so that they don't have to practice the myths and taboos associated with menstruation. They have the freedom to, nobody treats them like untouchables, etc. So this is something which is very, very harmful. It's not healthy to take any kind of birth controls for more than 6 months at a time, which is a known fact by gynecologists, etc. And there are people doing this just to delay the myths and taboos associated with it. which is why it's very, very important for us to talk more about menstruation, talk to girls before they start their periods, talk to mothers on how they can talk to their daughters about it, talk to boys, talk to husbands, and actually create that, break the silence like Mr. Vinod mentioned, and have that environment where people can talk about menstruation openly, because it is a natural phenomena. A single girl, for example, me, I will bleed for 8 years in my life, be it 5 days every month. It accumulates to a very long part of our lives. And it's very, very important that we have the freedom and the information to talk about it and educate as many people about it, so that they have the right to make informed decisions about themselves and manage their menstruation with dignity. So I think our learnings have been primarily with a lot of effort from what have been gone on in the last 2-3 years, and we've seen great results on ground. And we're very thankful for you for organizing this seminar as well for students and everyone else, because it's a very important topic, and we are very happy to collaborate in every way possible going ahead. Thank you so much.
Thank you, madam. A small announcement before presidential remark. We sent a feedback form link now in the chat box, as well as to your registered mail, which we will active for next 48 hours. Kindly fill the same and send back for certificate. The certificate will reach you from 7 to 10 days. May I now request Shri W.D. Ashok Sir, Honorary Trustee, Seshadripuram Educational Trust, to render presidential remark.
Good day to one and all. Good day to all the key speakers who have provided a very important knowledge to one and all who are present in today's international seminar, which was held by Seshadripuram Evening Degree College. The subject was an important one, as the inauguration was done by our secretary. He has given the introduction of our system, how it is being happening in our Bangalore college, as well as in other institutions which have been covered in our institutions. I would like to thank all the key speakers who are very versatile in their knowledge, and they have given utmost sincere advices and important conclusions where important things should be adhered to. So I would like to thank Dr. Virginia Madam, who has first spoken regarding how the improvement of girls in their attendance to schools and colleges and the performance increases on day-to-day basis during the menstruation. She has given a lot of it, and how the misconceptions during this time can come down and raise the self-esteem of each individual will be very important. Once it is unable to see that the confidence is built up in each individual, then their performance becomes much more important at each individual stage in all aspects of the society. As Madam was telling, even Lakshmi Murthy Madam was telling how the things were being discharged in earlier times, or even in some of the areas, as Lara Madam has also put it, that many of the girls, for example, in areas like Nepal or in cases of Iran, 51% of the attendance will not be there, and they will just miss the classes, and many millions of girls, women lack the adequate usage of facilities, as Lara Madam has put it. And at the same time, in many other countries like Ghana, they don't at all go to, they just miss the individual happenings, what is happening. They don't at all go out of the house during this period. So a lot of transformation is very much necessary during this period of time. And as this process, menstruation is a monthly reality. So yet in many countries, people still face serious challenges. How does menstruation affect lives? As Madam has put it, that each aspect, it affects in all aspects of life. That is even in education, dignity, economics, health, and participation of events. Everywhere the importance comes to important. So it becomes very necessary for educating girl, and hygiene management will be one of the major things in today's international seminar which has been done. And in many of the aspects what has been dealt with, even Vinod sir has given very good key notes, that is how it can be improved, how the attendance of schools and colleges by girls can be improved. he has also given a lot of points regarding that. And I would like to just say that even in our institution, as our secretary said, the very good facilities for girls and women staff, it has been provided that toilets and especially rooms has been individually kept for women, especially in all colleges and institutions. And as Lara madam has said, even we have provided incinerators with all facilities, and ducts have been provided so that, as she has pointed out, high heat is used, and the fumes and other things should not come into direct contact. So very good ducting has been done in all our institutions, because I just want to say what we have also adopted, what she is actually saying, we have done even that in the source. And coming to the one, I just want to say, in one of our institutions, in our management institutions, we students have participated in this menstrual event. That is, one Nisha Belegare in Bangalore had taken up the concept of this, and she had moved to the rural entrepreneurship, and our students had just gone with them, and they have gone for the rural, how to make these pads, how this, whatever the madam Lakshmi madam was telling. Similarly, they have taken up projects and they have done it, and how the marketing has to be done. All these things have been just done in a primary level. I cannot say that it has come to your levels of thinking, but a primary touch was made, an effort was made, and we would like to see that, as Vinod sir has said, a very good contribution can be made to all the institutions, and we would like to take up the maximum advantage of Vinod sir in this aspect also, so that many more changes can be brought about. I would like to thank Dr. Virginia madam, Dr. Lakshmi Krishnamurthy madam, Lara madam, Vinod sir, to give their venerable and valuable suggestions in this international conference held by Seshadripuram Evening Degree College. And at the same time, I am thankful for the principal, Satish sir, and convener Darappa sir, coordinator Sunil sir, and also Geeta madam, who has taken up this and made it a wonderful event. Thank you very much. Thank you, one and all.
Thank you very much, sir, for the presidential remark. I request Varshini Sushma, administrative staff,
Question
to render
ತಗೊಂಬೋದು.
vote of thanks. It is my proud privilege to propose vote of thanks for this international webinar on menstrual health management from Chetana, Women Empowerment Cell of Seshadripuram Evening Degree College. At the outset, I thank WSSCC, Geneva, Switzerland, Tata Trust and Jatan Sansthan for associating with us for this international webinar. I would like to express our sincere gratitude to today's chief guest who has rendered keynote address, Dr. Virginia Kamova. Thank you very much, ma'am, for making this international webinar a grand success. I'm humbled and grateful to you. I express our sincere thanks to Dr. Lakshmi Murthy for enlightening us with menstrual health management. Thank you very much, ma'am. I express our sincere thanks to our guest of honor, Sri Vinod Mishra and Ms. Lara Gulia. Thank you, sir. Thank you, ma'am. I would like to render our thanks to Dr. Vudepi Krishna, sir, Honorary General Secretary of Seshadripuram Educational Trust, Bangalore, India. As usual, we are touched by your words of wisdom, sir. Thank you very much, sir. I express our wholehearted thanks to W.D. Ashok, sir, Honorary Trustee, Seshadripuram Educational Trust. Thank you, sir, for your presidential remarks. In his absentia, I thank Professor C.L. Basvarajaya, sir, Chairman of Governing Council, SEDC, and I thank all the office bearers and trustees of Seshadripuram Educational Trust. My special thanks to our beloved, vigorous, dynamic principal, Professor N.S. Sati, sir, who is the strength of our Seshadripuram Evening Degree College. I would like to thank all the office bearers of WSSCC, Geneva, Switzerland, Tata Trust, and Jatan Sansthan. I would like to thank Darappa Konur, convener of Nisarga Mitra, Geeta V, convener of Chetana, Women Empowerment Cell, and Sunil Kumar, coordinator of IQAC, who have technically helped us to materialize this webinar. I express our gratitude to all the principals, conveners, and members of our sister institutions and other colleges, academicians, research scholars, students, and delegates across the globe for participating in this webinar. We will ever remain grateful to our teaching and administrative staff for their support. Thank you, everyone.
Thank you, Lakshmi Madam. Thank you, Vinod sir.
Thank you. Thank you very
Virginia
much.
Madam, thank you.
Thanks.
Ashok sir,
Thank you,
sir.
Lakshmi.
Thank you. Thank you.
Thank you.
Lara
Come,
Madam, thank you.
come and visit us. Come and visit us.
Sure, Madam.
Thank you so much.
Yeah, Madam.
Virginia,
And
come and
we
visit us.
will
All
continue
right.
this
Thank you for the
collaboration.
invitation. I will.
Virginia,
Sure.
we should continue this collaboration with the Seshadripuram Educational
Yes,
Trust.
sir.
Absolutely.
Yes,
We will, sir.
exactly.
Yes, sir.
Yeah. Mhm.
We will do, sir.
Nice to see you, Lara, again.
Yes, nice to see you.
Thank you, Lakshmi.
Tara, thank you. Very
Thank
good. You speak very
Thank
well about Uttarakhand. Very good.
Thank you, sir.
So we will end now.
Very shortly, we will meet in one more international. Very shortly, we will meet in one more international webinar of our evening college, that is on 12th next Friday. The topic is Green Democracy, Relevance of Ambedkar Ideas for Environmentalism. The registration link is in the chat box. Once again, thank each and everyone. Now we conclude the webinar.
Thank you. Thanks.
Thank you, sir. Thank you very much.
Thanks, Virginia.
Thank you. Have a good afternoon.
Good afternoon. We will speak later on.
Thank you. Yeah.
Stop. Sunil?